This video is intended for patients who have been prescribed the LifeVest, as well as their families and caregivers. It will provide an overview of the LifeVest wearable cardioverter defibrillator and includes information about assembling, wearing, and caring for the LifeVest. Chapter 1. LifeVest Protection from Sudden Cardiac Death. Every year, thousands of people like you are told by their doctor that they are at risk of dying suddenly because of their heart condition. This means that the heart could develop a life-threatening heart rhythm, which, if not treated quickly, could lead to death in minutes. This is called sudden cardiac death. This news can be difficult to accept and usually comes at a time when you may already be overwhelmed with talk about lifestyle and dietary changes, important medications, and possible medical procedures. You may be asking, what exactly is sudden cardiac death? What is the LifeVest and why do I need one? How long will I need the LifeVest? And how can I get my questions answered? In this video, we will discuss these and other questions you may have about the LifeVest wearable defibrillator, including how the LifeVest can protect you from sudden cardiac death. Let's begin by answering the first question. What is sudden cardiac death? This is what a healthy heart looks like as it pumps blood through the body. This rhythmic pumping action is the heartbeat, and this is controlled by the heart's electrical system. In some patients, there is a problem with the heart's electrical system, and the heart suddenly starts beating so fast that it quivers or shakes instead of pumping blood to the body and brain. When this happens, the patient can collapse and die suddenly. This is called sudden cardiac death, also known as SCD. It occurs without warning. Some people confuse sudden cardiac death with a heart attack, but they are not the same. A heart attack is caused by a blockage that stops blood flow and the oxygen supply to part of the heart. Within a short time, these cells start to die, causing damage to the heart. With a heart attack, a person may feel severe chest pain or other symptoms, but usually remains conscious. Sudden cardiac death, however, occurs without warning and without the person feeling any signs that something is about to happen. With sudden cardiac death, you suddenly fall unconscious and will not be able to call for help. It may even happen while you sleep. The LifeVest can protect you from sudden cardiac death by delivering a treatment to restore your heart's normal rhythm. With the LifeVest, the monitoring is constant, the protection is immediate, and you and your loved ones will have the peace of mind that comes from knowing that the LifeVest is ready to help you if you need it. Now, why do you need the LifeVest? Your physician has prescribed the LifeVest to you because your current condition puts you at risk of dying suddenly. The LifeVest is a wearable defibrillator that is worn by patients who are at risk for sudden cardiac death. A defibrillator is a medical device that provides a treatment shock to the heart when a life-threatening heart rhythm occurs. Wearing the LifeVest makes sure that you are always protected because the LifeVest constantly monitors your heart. If the device detects that you are having a life-threatening heart rhythm, it will automatically deliver a treatment shock and restore your heart back to its normal rhythm, usually in less than a minute. The LifeVest does not need anyone else to be there with you or to intervene in any way for it to work to save your life. The LifeVest's ability to quickly treat a patient is the single most important factor in saving that patient's life. Your life. All you need to do is wear the LifeVest and provide minimal care. Because sudden cardiac death can happen at any time and without warning, you must wear the LifeVest at all times, even while you sleep. This means wearing your LifeVest when you go to your place of worship, to the restaurant, to do chores around the house, even to your next doctor's appointment. How long will you need the LifeVest? Your physician will determine how long you will need to wear the LifeVest. So until your physician tells you that you no longer need to, wear the LifeVest all day, every day, even if you feel like your heart is doing better. The only time you should remove your LifeVest is for a short shower or bath. Remember, sudden cardiac death occurs without warning, but your LifeVest will protect you if you wear it all the time and wear it as instructed. Preferably, you should try to take your bath when someone is at home with you. One of the key features of the LifeVest is the alerts and voice prompts that keep you informed about what the device is doing. The LifeVest has 3 types of alerts: vibration alerts, gong alerts, and siren alerts, which inform you of different situations. The alerts are all part of the normal functioning of the device and let you know that the LifeVest is working to protect you. If you get an alert, you should take action quickly by checking the LifeVest monitor to see what action is required. For vibration and siren alerts, you should quickly press the response buttons. For more information on LifeVest alerts and directions on how to respond when you feel or hear the alerts, review the chapter entitled Responding to LifeVest Alerts, or check your patient manual. Your patient manual also contains additional information about the LifeVest, including details about regular washing and other care. If you have any questions, please review these materials carefully. Here are some important reminders. There are no symptoms for SCD. It can happen at any time. Wear the LifeVest at all times so that you are always protected. Only remove your LifeVest for a short shower or bath. If you still have questions about the LifeVest, call ZOLL at 1-800-543-3267 at any time of the day or night. We are here to answer questions and provide assistance with your needs. Call us at 1-800-543-3267 anytime.